Hello, today I'm going to talk about lupus. What is lupus? Well, systemic lupus erythematosus is an autoimmune disorder. The erythematosus refers to the malar rash that extends across the cheeks and the bridge of the nose. Who does it tend to affect? Well, lupus is an autoimmune condition and it typically affects women. The women are normally of reproductive age. In fact, female to male ratio is 10 to 1. It is more common in those of Afro-European and Asian background and those with a family history of lupus. What does it affect? Well, lupus affects a range of bodily systems. In other words, it is multisystemic. What is the clinical pattern of lupus? Lupus presents in a very non-specific manner. It is associated with fever, fatigue, and feeling generally unwell. It has a relapsing, remitting pattern. The American College of Rheumatology have a revised criteria to help remember lupus. According to this criteria, any 4 of 11 features constitutes lupus, and this can be remembered by the mnemonic SOAP-BRAIN MD. The S refers to the serosal surfaces, such as the pericardium and pleural regions, so that's pericarditis and pleurisy, and also other problems within the lung, so that's typically the heart and the lung. 2. The O is for oral ulcers, which are normally painless. The A is for arthritis, which is normally non-erosive, and it'll affect 2 or more peripheral joints. P is for photosensitivity, and this refers to the malar rash I mentioned earlier that extends across the bridge of the nose and onto the cheeks, sparing the nasolabial folds, and it gets worse typically under UV light. Blood disorders. The B is for blood. This includes leukopenia, lymphopenia, and hemolytic anemia. The R is for renal disorder, and there may be protein in the urine. You should do a dipstick. An ACR ratio can be useful, and also a renal biopsy can come in handy. Anti-nuclear antibodies are the A in this mnemonic, and these are found in 95% of cases of lupus, but they are also found in healthy individuals and those with autoimmune hepatitis, so they're not 100% accurate. I is for immunological disorder, and this includes antiphospholipid syndrome, or antiphospholipid antibodies rather, anti-double-stranded DNA and anti-Smith antibodies. And N is for neurological disorders such as seizures and psychosis. M is for malar rash. D is for discoid rash. And there's also other symptoms including alopecia and splenomegaly. Of all these symptoms, rash and arthritis are probably the most common. Joint symptoms are present in 90%, and skin is also very commonly affected. The typical malar rash is butterfly shaped and is seen in more than 50% of patients. Of these symptoms, cerebral disease and renal disease are the most serious. So what are the causes of lupus? It can be related to genetics. You can also get drug-induced lupus, and these include carbamazepine, phenytoin, and some TB drugs can trigger this. Epstein-Barr virus has been suggested as a trigger for the development of lupus, and also, as I spoke about earlier, UV light can trigger lupus. What tests can be done? You do a full blood count to see are there any blood disorders such as leukopenia, anemia, and thrombocytopenia, a urine, serum complement, and C3 and C4 are typically reduced in lupus, and you check for anti-nuclear antibodies, which are commonly raised. How can lupus be treated? Well, it can be treated non-pharmacologically as well as pharmacologically. It's important that patients use sunscreen and stop smoking, as smoking causes flares and worsens prognosis. Also, patients with lupus have to be careful. They tend to have a higher cardiovascular risk, and stopping smoking is useful to reduce this risk. Also, if you have lupus, pregnancy should be planned due to the risks of complications to the baby. The oral contraceptive pill may worsen lupus due to the hormones. It is best to use barrier methods or progesterone pills as contraception in this case. It can also be treated pharmacologically, and it should be treated pharmacologically as well as non-pharmacologically. And you can use NSAIDs, but it is important to check the renal function, as people with lupus are prone to kidney difficulties. And also hydroxychloroquine can be used to help with the skin disease and fatigue if it's not controlled by non-steroidals. Some texts say that hydroxychloroquine is first line for lupus. If patients are on this, they require regular eye checks to check for retinal toxicity. Steroids can also be used, and you can use these with a steroid-sparing agent. And those are the main treatments of lupus. Another condition which often coexists with lupus is antiphospholipid syndrome. It can exist on its own without lupus too. And antiphospholipid syndrome is seen in patients that recurrently miscarry and have thrombosis, and this can be arterial or venous thrombosis, coupled with antiphospholipid antibodies. And the antiphospholipid antibodies include the lupus anticoagulant, which, do not be confused by this, lupus anticoagulant does not test for lupus, it is a test for the antiphospholipid syndrome. The antiphospholipid syndrome can be commonly remembered by the mnemonic CLOT. C for coagulation defects, L for livedo reticularis, skin rash, and O is for obstetric recurrent miscarriages, and T is for thrombocytopenia. For diagnosis, there needs to be one clinical and one lab finding. So that could be the clots or the recurrent miscarriage with one of those two antiphospholipid antibodies. Thank you for listening, and don't forget, if you enjoyed this video, to hit a like or subscribe to this channel for more videos. Thank you.